If your X-ray, MRI or CT scan is showing aneurysmal bone cyst, then what does that mean? Aneurysmal bone cyst is a sort of tumor or cyst in the bone that causes bone to balloon out. In simple sense, it means that the normal bone there is deficient and there is a balloon or swelling in the bone. Normally, this is not a cancerous condition. It is a simple benign condition, which is more commonly seen in age group less than 20 years. So normally what happens whenever there is this cyst, the symptoms are either in the form of ballooning out, that means the pressure symptoms, or rarely there could be pain. However, if there is any fracture in this area, then it can cause real pain. Normally, this cyst is not diagnosed unless there is a fracture. So if there is a fracture and your doctor sees through your X-ray or MRI and suggests that there was a cyst which has not fractured, so don't worry. Rarely this fracture might require a fixation or stabilization procedure, but normally when this fracture heals, this cyst automatically disappears. Rarely when this cyst is large or big enough its size, your doctor might suggest to undergo a surgical procedure known as curettage and bone grafting. That means we clear the cyst area and we fill it up with bone graft so that when the bone graft incorporate, it forms a normal bone. The most common location for this cyst could be here in the arm or in the forearm or around the wrist or around the knee joint, especially in the lower part of the thigh bone or upper part of the leg bone. Sometimes we can even find it in calcaneum, that is the heel part, or spinal part or pelvis part. So if your doctor has diagnosed that you have a simple ABC at some point, at some part of your body, don't worry, just trust your doctor, and in most of the cases, simple observation is required, or rarely, if it is a large cyst which is prone for fracture, your doctor might suggest you surgery in the form of curettage, bone grafting, and maybe fixation also if required. Thank you.